Hi, welcome to this unique hair care initiative by IPCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, hair problem was associated with middle age when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people having hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided and can be fixed by managing to modify our faulty lifestyle. Today, we have with us Dr. Pallavi Kashyap. She is MBBS, MD in DVL, and she is gold medalist and has been practicing medicine for over many years now and is known for her exceptional medical expertise in trachology, dermatosurgery, aesthetic dermatology, and cosmetic procedure. She currently practicing as consultant dermatologist at Dr. Kashyap Skin, Hair and Laser Clinic, Patna, which houses all the latest devices and technology for skin and hair treatment. Dr. Pallavi Kashyap has dedicated her career to diagnosing and treating a wide range of skin and hair conditions. While providing personalized healthcare services to her patient, she takes the time to listen to her patient concern and work closely with them to to provide them a treatment plan that meets their individual requirement. Dr. Pallavi Kashyap is aware for the need for the patient awareness and education about hair care and spend a lot of time in giving talks across various platforms. Thank you, Dr. Pallavi Kashyap, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Thank you. Thank you so much, Mona. Yeah, it was a very elaborate this introduction. So thank you.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया सो डॉक्टर टुडे वी आर गोइंग टू डिस्कस द हेयर केयर इन करंट सिनेरियो सो व्हेन वी टॉक अबाउट हेयर केयर द मोस्ट and the foremost question which comes up to our mind is the hair loss which is now being faced by every one of us irrespective of age or gender. So doctor, what's normal and when to be concerned for? Can you please enlighten us?
Of course, hair loss is a very big and a very vast, wide range problem. And we get a lot of patients at the OPD for hair loss. See, you have to basically segregate your problems. And as you said, that when you have to worry is when you see that your hair loss is more than 50 to 100 strands per day. When you are losing that kind of hair for a week or for weeks together, then it is alarming that you should go to your dermatologist and consider taking treatment. Then again, hair loss is of various types and it can be divided among age groups also and patterns also. It is associated with so many underlying causes also. So you have to be quite careful and quite vigilant also. You cannot be just careless enough that kuch hair loss hi to ho raha hai, and you keep on postponing it. So you should be little vigilant with what you're doing and how you're taking care of your hair. You should be quite vigilant about any infections in your hair, especially dandruff or any kind of pattern you are developing in your hair, or any kind of patchy hair loss you're having, any kind of pattern, again, female pattern, male pattern. There's so many things. So yeah, quite vigilant. Be little aware of what is happening with your scalp and your hair.
Yeah, so whenever there is alarming sign, it instead of just ignoring, we should visit the doctor.
Of course, of course. And please don't indulge into self-treatment and whatever you see over internet that can really worsen it.
Yeah. So, like doctor, you have already let us know that why, when to be concerned for the hair loss. So, another question is like, what are like general causes? Why does the hair loss happen, and what are the general causes of hair loss?
See, again, as I discussed, that there are various causes behind hair loss, and we can segregate according to the age group, according to the male and female. Then if we consider in females, then again, hormonal imbalance, PCOS, and anemia and stress and thyroid disorders are the initial causes of hair loss. And again, if you are having postpartum hair loss is very common, like post pregnancy. Then again, if the nutritional value is not good, which is because females, they have a habit of not taking care of themselves but rest of the family, so they just kind of avoid their own nutritional value, so they shouldn't do that. So yeah, in females generally, this, again, if it is associated with some autoimmune causes, then of course alopecia areata. Then again, if we take the hormonal causes and the autoimmune causes together, then female pattern hair loss is there. So yeah, in females. When it comes to male, then of course the androgenetic alopecia, in which we see patterned hair loss. Then again, immune causes are there, which leads to alopecia areata, then cicatricial alopecia. If we talk about seborrheic dermatitis, simple dandruff issues can also lead to hair loss. And again, DHT plays a very important role when it comes to males, especially. So that also leads to hair loss. And of course, thyroid issue in some men definitely leads to hair loss. And yeah, the nutritional value, of course.
Okay, very informative, doctor. So, doctor, nowadays we all are having bad lifestyle, like working late hours, working from home, eating anything. So, can a person's lifestyle also play a role in hair loss?
So true. See, and when we talk about lifestyle, we talk about our working hours, we talk about our the environment we are living in, we talk about the food we are having, we talk about our eating habits, which includes the kind of food we are eating, especially when it comes to the nutritional value of the food. Then, of course, smoking, alcohol, that is also including in our lifestyle. So, yeah, all these play a very important role when it comes to hair loss.
Okay, so it's lifestyle is really important to
It
manage.
is indeed.
Okay. So, doctor, we are talking about hair loss and so many causes. So, are there what are the medical treatment options available for hair loss? Is there some topical or surgical or non-surgical or oral by which you can eat and manage the hair loss?
Yeah. So once you have hair loss and you see that you are losing hair, so the one thing you should do, visit your dermatologist. Let the specialist see that what is the reason behind your hair loss. Because sometimes the reason is important, when because sometimes what we do, we take some serum or whatever comes to our knowledge, we apply a lot of other things also, onion, garlic, various things. I can't even name them. And then people have this habit of oiling their hair often, that we use certain oil and our hair loss will be rectified. But the most important thing is that you should know what is the reason behind it. And once you get the reason, then only you will get to know that. Yes, this is the treatment available. Because if we don't know the reason behind it, it becomes very haphazard. So,
Hmm.
again, as I discussed, there are various reasons. So, if you have anything, there are oral medications available, there are surgical treatments like hair transplant is available, and then grafting is available. Then, different kinds. These days, we do hair transplant also with different techniques. So, yes, it is avidly available. But again, I would suggest that just don't go to anybody for hair transplant. Just see if that person is qualified enough to do your hair transplant or not. Then again, the PRPs, the GFCs, that is the non-surgical treatment, but slightly invasive. And of course, the topical treatment is also available. But knowing the cause and then treating it would be really good. Some people just hesitate, they don't go for certain investigations also, कि बाल झड़ने के लिए क्या टेस्ट कराना है, डॉक्टर्स तो कुछ भी का टेस्ट करा देते हैं. पर actually sometimes your vitamin D3 levels, your hemoglobin levels, your thyroid levels are also responsible behind it. So why not just test it and do it now? That is more important, right? So don't hesitate visiting a dermatologist when you have simple hair loss also.
So, visiting doctor is important instead of
Of
blind.
course, yeah.
So, doctor, nowadays, one word called nutraceutical is getting a lot of focus. So, is it what is nutraceutical and what is the role of nutraceutical in hair health?
See, the micronutrient deficiency causes hair loss, and there are various micronutrients like vitamins, like vitamin. You have vitamin B3, you have vitamin B7, you have vitamin B9, you have vitamin D, E, A. So all these can also lead to hair loss. So we need to know that what is basically the deficiency cause and what vitamin is basically patient deficient of. So that is how we treat the patient. Sometimes vitamin D3 itself can lead to lot of hair loss and nail changes. So recently, today also, I found one patient was having D3 levels low. She was quite hesitant to actually go for the test, but after counseling her, she went for the test and she was quite deficient of vitamin D3. So now I've supplemented her and counseled her again that you should take it, because once you start with hair treatment, it takes time. It doesn't happen that you do the treatment for 1 month and you are completely cured. That doesn't happen, right? So you have to be quite consistent with your hair treatment. Do it for 5 to 6 months, then only you'll see the results. So when you start the treatment, be consistent with it. That is also important. Of course, the micronutrients play a very important role.
Okay. So, doctor, like even there are some plant extracts like grapeseed, omega-3 fatty acid. Do they promote hair growth?
Plant extracts, see, I have read few papers, and some papers say that the grapeseed extracts are helping in the as a DHT blocker, but I don't know how far it's true, because there is not much of literature available. But again, supplementing something just topically would not do the game, you know. So you should know that what kind of supplementation is actually needed for you. Just taking omega, of course, the omega fatty 3 hair are antioxidants, so definitely they'll help you with your hair growth. You can take it, but sometimes people just take it like as if it is something related to their food only, or some dessert. They're taking it without any doctor's consultation, just going to the pharmacy, reading it somewhere, half there, half knowledge, and just doing it and taking it. So that is also not good. No? So you should always consult a doctor before taking any multivitamin or any omega-3 fatty acids also.
Okay. So, doctor, like you have enlightened us about so many information. So, another question is like there are so many macronutrients and micronutrients. So, what exactly is micronutrients? You have already told us about.
Yeah, I discussed that exactly. That
So,
again, B3, B7, and A, E, D, all
so
these, and some elements also like zinc and iron.
okay, these nutrients are not available in our diet.
Of course, see, because these nutrients have to be absorbed also in your body. Even if they're available and they're not getting absorbed properly, then they're of no use. So sometimes you have to supplement them if they are not sufficient in your body. So that's how we take nutritional supplements, and that's how this business and this industry of micronutrients is flourishing so much.
Okay. Doctor, like when we have talked about hair loss, so another very common problem which is faced by all of us is dandruff. So,
Hmm.
does dandruff actually cause hair fall, or dandruff is just dandruff in the hair?
See, dandruff is nothing. It is kind of fungal infection, which we generally call malassezia furfur, or we name it as seborrheic dermatitis in our language. So, dandruff is certainly, if you have infection in your hair, then definitely it will cause hair loss. So, getting rid of your seborrhea and getting rid of your dandruff is very important. Sometimes people think that having dandruff is something very natural, and everybody has it. So, it should not be treated. और कभी कुछ एंटी डैंड्रफ शैम्पू ले लेंगे, लगा लेंगे, उससे ठीक हो जाएगा, क्या जरूरत है डॉक्टर को दिखाने का, या why do we need a consultation for dandruff? It happens to everybody. True, it happens to most of the people, but yes, if you are constantly suffering from it and constantly your scalp is itchy and flakes are there, there are different consistency of dandruff also. Sometimes it's dry, sometimes it's very oily and sticky. So if you're facing that consistently, for more than 1 month, 2 months, some people are suffering from dandruff for years together, and then still they are not serious about it. So yeah, that is one of the reasons. Yes, dandruff causes hair loss. So please go to your doctor, get yourself treated. Why do you have to live with fungal infection in your hair now?
Yes, yes, doctor. Absolutely right, doctor. So, doctor, stress is something which is not avoidable, like, and by any of us. So, is what is the impact of stress on our hair health?
Stress comes from various sources. Sometimes it is the avoidable, sometimes it is non-avoidable, but we should always try to practice certain thing in the full day to get rid of it. Any physical exercise or any meditation or anything which soothes your brain, which soothes your nervous system, one should do that. Because yes, we live in a very stressful world, very competitive world. Everybody wants to do their best, look their best, and achieve everything in their lives. But yes, this rat race has to stop somewhere, because if we keep on stressing about things, then we'll certainly have hair loss. And if you're having it, get it cured, because if you were completely in stress and again having hair loss, that will also cause stress. So it is adding upon your stress, right? I've
Yeah.
seen some patients, some girls coming to the OPD and literally crying because they have hair loss.
Mm-hmm.
So why to do that? Come early to the doctor, get yourself treated,
Yeah.
stay happy.
So instead of waiting for like complete hair loss, better to
Yeah.
visit the doctor. Yeah. So, doctor, one thing is like when we are having stress at home and we are nowadays working from home, हमारी मम्मी लोग बहुत बोलती हैं कि ऑयल का मसाज कर लो, अच्छे से रगड़ लो, बाल बहुत लंबे हो जाएंगे, शाइन करेंगे. So, what do you think? Oiling hair is a ban or a boom?
See, oiling what helps, it certainly helps, but you cannot just keep on oiling your hair and keeping it for the rest of the day, and then keeping it for the rest of the night, because it attracts a lot of other dirt, dust, and the sweat also accumulates in your hair because of the oil, and it mixes up with oil and creates another food for fungus. So the oil should be only applied half an hour before your shampoo, because it helps to moisturize your hair, condition your hair. Okay, so just apply it half an hour before and wash it off. You should not keep the oil in your scalp. These days in monsoons, the hair becomes very brittle, the hair becomes very frizzy. So I often tell my patients that you can oil every day, but just half an hour before the shampoo and wash it off. So the hair will be more smooth. They will have more conditioning effect also. And you have to apply oil also before the shampoo, and then you have to apply conditioner also post your shampoo. That is also very much important.
Okay. So oiling hair also promote hair growth, or it's just a myth?
Sometimes, see, hair growth का जो reasons है ना वो बिल्कुल different है, because hair growth will happen through the roots, right? So root में जो stem cells होते हैं उसके through आप hair growth promote कर सकते हो, और oil तो उतना penetrate करेगा ही नहीं. So there is no quite evidence that oiling causes increase in hair growth, something like that. It helps in moisturizing your hair and keeping your hair nourished, but I can't say that it promotes.
Okay. So, doctor, can you please give us important tips for healthy hair?
Yes. So people generally have this tendency that if we keep on shampooing our hair daily, that will spoil our scalp. But you should be quite consistent with your shampooing. You should have daily shampooing, you can do that. But again, the drill remains the same. You have to condition your hair, do deep conditioning so that your hair doesn't become very dry and brittle. Because, of course, the shampooing will strip off the natural oil. So you have to provide that to your scalp. Again, once in a week, you can have an anti-dandruff shampoo as well. And of course, you have to do a conditioning after that as also. Because once in a week, if you are using anti-dandruff shampoo, then you're actually avoiding a lot of fungal infection happening to your hair. Then oiling, as I said, don't keep oil too much in your scalp. Just wash it half an hour before the shampoo and use it and then wash it off. Okay. And of course, don't go for so much of chemical treatment. These days, people are going for permanent straightening, priming, then keratin treatments, and so I've recently heard new term called uh, hair botox therapy and
Yes.
something like that. Yeah. So please don't experiment with your hair and be very gentle and be very basic. Don't apply so much of chemicals. Hair mask लगा रहे हैं तो कुछ लोग मुल्तानी मिट्टी भी लगाते हैं बालों में. Don't do all that and don't color your hair often, you know. And if you are using hair coloring, make sure that you are not using it more than once in a month. That is more than enough. Don't go for so much of chemical treatment and trim your hair. Trim your hair every twice in मतलब 2 months में एक बार आप trim कर लो बाल. That is more than enough. And again, permanent straightening nahi karna hai. Be very gentle. See, it is a part of your body, so take care of it. And if you're having any issues, you should never, ever, never, ever go for self treatment. Just visit your dermatologist and get yourself treated.
Yes, doctor, very informative. Just as a female, it is very difficult to resistant the chemical treatment because they attract a lot.
Of course they do, but your hair is your property and you should take care of it as you're taking care of the rest of the body. Because so many patients come to me after doing multiple keratin sessions. They promise you that they'll put extra protein to your hair, but that certainly doesn't happen. What you can do, you can have good proteins in your diet. You know, have good proteins in your diet. I'm not saying that you should start taking protein supplements, but yeah, natural diet also contains a lot of other protein sources. Take that. So that will help you with your hair, with your nails, with your skin. Why can't we do it with the diet part? You know?
Yes,
Why do you have to go for external unnecessary things which are not required? And don't go for shampoos which smell very good, you know, because fragrance is another chemical addition to the shampoo. Don't go for a lot of sulfate shampoos. Stick to basic shampoos and which have less sulfates and which are not that good in fragrance and which are rich in caffeine. Good shampoos are there, so do that. And please condition your hair. People avoid condition, but please condition your hair. That is very, very important.
so, doctor, this discussion was very informative, and I'm sure our viewer would be benefited by it. So, doctor, can we take some live questions from our audience, please?
Of course, yeah.
Okay, the first question from our live audience is, what is the cause of gray hair? Because my daughter is just 12 years old, and initially her hair was normal, but now her hair is going gray, and I don't know how to stop it.
See, premature growing of hair has various reasons, and you cannot just specify a treatment right now over this session because sometimes nutritions also play a role. Sometimes there is an autoimmune condition involved to the premature graying. So you have to basically examine the patient and then go for a conclusion that what is the reason behind it. So I would suggest that she should visit a nearby dermatologist and take their consultation.
Okay, but the premature gray hair is reversible.
See, graying of hair is not reversible. We can prevent graying of hair. But once the hair is already gray, you cannot turn it into black.
Yeah. Absolutely right, doctor. So another interesting question from our audience is, doctor, there are so many hair oil and hair serum. What is better, hair oil or hair serum?
As we discussed, that yes, hair oiling is good, but please don't go for such fancy and fragrance wala oil. Just stick to basic coconut oil and plain coconut oil half an hour before the shampoo. and wash it off. And when it comes to serum, again, don't go for very fancy and fragrant serum. और आजकल बहुत सारे different company का हर company का serums available है. So serums containing Pro Capel is good. You can actually use that. But again, it is required, whether it is required for your hair or not, that is also important. And what serum is required for your hair. So if you want कि मेरे को serum use करना है, so why can't you take a consultation and then start it?
Mhm. Yeah.
Because sometimes if you start any product just haphazardly, it might cause hair loss. So why to take that risk?
Yeah, blind self prescription is that.
Exactly. Yeah.
Yeah. So another very okay, this viewer is asking, Doctor, I got COVID in 2020, and after that, I am facing a huge amount of hair loss. Is it because of COVID or I have some deficiency?
Of course, post-COVID hair loss is very common, and still, I mean, patients having COVID into 2020, 2021 are still coming to the OPD that since COVID, my hair loss is just not stopping. So yeah, it is can be COVID can be one of the reasons, and of course, nutrient deficiency can one of the other reasons also. So you have to find out that if you have any nutritional deficiency or not.
Okay. Another question from our audience is, Doctor, I exercise a lot, and because of before it wasn't there, but now I'm doing severe weight training. So, but also facing hair fall nowadays. So, is it because of excessive weight training I'm facing hair fall?
See, when you do a lot of gymming, there's a lot of sweating, and people generally don't wash their hair post workout. And that also causes accumulation of seborrhea in the scalp and leads to hair loss. That is one of the reasons. Again, if you're doing weight training, then certainly you have to take that kind of nutrition also. Some people go for crash dieting and only protein diet. Our body needs complete balanced wholesome diet also. As we discussed, that micronutrients play a very important role. So she has to find out that whether there is any nutritional deficiency or not. That might be one of the reasons. And again, in women there are so many other reasons also. So she can visit a dermatologist and find out the reason behind it and get yourself treated.
Okay, doctor. Another very interesting question from our viewer is, डॉक्टर किसी ने मुझे बोला अनियन ऑयल लगाने से या फिर अनियन का जूस बालों में लगाने से या फिर लेमन का जूस मिक्स करके लगाने से बाल बहुत लंबे हो जाते हैं मेरे बहुत कट करने के बाद लंबे हुए ही नहीं तो क्या मैं ये लगा लूं?
As we discussed earlier, now people are using all these things. I missed lemon. Now she has added lemon also. So please don't do all this to your hair. This will just not help you. Please visit a dermatologist and find the reason behind it and then get yourself treated. Because certainly applying garlic, onion, and again the lemon to your scalp will not help you.
Okay, again, the same viewer is asking, doctor, there are also various hair care regimen, तो क्या वो use कर सकती हूँ?
Why can't you visit a professional and then ask that person? By with professional, I mean a doctor.
Yeah, instead of self-prescription. And she replied, okay. Okay. Doctor, does wearing hat frequently lead to hair fall?
Yes, it can, because again, the sweat accumulates in the scalp, and sometimes the contact surface also has certain infection because we are not prone to wash that. So contact dermatitis can happen, and again, the dandruff can happen because of wearing hats. So yes, it can cause hair loss. So whenever you are wearing such things, please wear a cotton handkerchief or a cotton bandana and then wear it and wash that often so you don't acquire any infection wearing it. And the sweat will be absorbed in cotton handkerchief or bandana and you can wash it so you'll not have anything.
Okay. Another very interesting question from our viewer is, डॉक्टर सन में रहने से क्या बाल सफेद होते हैं?
Sorry?
सन सूरज में रहने से बाल सफेद होते हैं?
Yes, sun exposure has a very crucial role in hair loss. Yes, it can happen because अगर आपका sun damage है तो आपको hair loss भी होगा and of course आपका hair color भी deteriorate करता है. So
ओके.
cover your hair or you can have antioxidants which actually act as a sun protecting factor. Antioxidants are place सकते हैं or then you can check for any nutritional deficiencies you have that you can do. Yeah. This we have not discussed. So it's a very nice question.
या डॉक्टर, आपने एपिसोड के बीच में बोला पीआरपी, ये क्या होता है? इससे बाल आ जाएंगे मेरे?
Of course, it is a platelet-rich plasma therapy. आपका blood लेके उसे centrifuge करके आपको स्कैल्प में इंजेक्ट करते हैं. बट अगेन पीआरपी के भी इंडिकेशंस होते हैं और उसके मल्टीपल सेशंस भी लेने पड़ते हैं और ये आप ऐसे ही रैंडमली नहीं ले सकते हैं. आप अपने कंसल्टेंट से जाके मिलिए, उनसे पूछिए कि क्या रीजन है हेयर लॉस का और वो आपको क्या सजेस्ट कर रहे हैं आपके हेयर लॉस ट्रीटमेंट के लिए. देन गो हेड फॉर इट.
Okay. Okay. Another question from our viewer is, Doctor, you said postpartum pregnancy can cause hair loss. So I had, my delivery was fine, but I had gestational diabetes and now I'm facing hair fall. So is it because of the gestational diabetes which I had before?
Both are the reasons. When you have diabetes, of course, an autoimmune cause is related here. And again, postpartum hair loss is very common. So both the reasons can lead to hair loss.
Okay, means diabetes during pregnancy can also lead.
Of course, it can, yeah.
This problem is faced by many of females now. Doctor, I have PCOS and my PCOS is not able to control and it scores around 5 and also having hair fall. So is it because of PCOS?
Of course, see, PCOS is a condition where you lose your hair from your scalp and you have your hair on the face. You get hirsutism. मतलब मैं पेशेंट्स को हमेशा बोलती हूँ कि जहाँ बाल नहीं होने चाहिए वहां आते हैं और जहाँ होने चाहिए वहां से चले जाते हैं. तो आपको पीसीओएस को ट्रीट करना है. पीसीओएस को ट्रीट करने का इनिशियल तरीका तो यही है कि आप अपने लाइफस्टाइल मॉडिफिकेशंस करने होंगे. आई डोंट नो व्हाट हर वेट इज एंड व्हाट हर फिजिकल कंडीशन इज, but she has to change her lifestyle completely because lifestyle modification से काफी better हो जाता है PCOS. And of course your stress levels plays a very important role there. So please practice some meditation, some yoga, and rest. You can always visit a consultant and get yourself treated because I can't treat you like this here.
Yeah. So, once the PCOS is corrected, then we can visit the hair doctor, like dermatologist, like.
You can do the treatment simultaneously.
Okay. Simultaneously is also possible.
Of course, yeah. Why to wait for? Because if you'll constantly wait for, you'll start losing ample amount of hair, no?
Yeah.
Yeah, that will again cause stress and it will become a cycle. So,
Yeah. Another question is, doctor just want to ask, with age hair loss होना normal है क्या?
see, with age definitely आपको hair loss होता है because आपको postmenopausal hair loss भी होता है. So yeah, it is common and your hair becomes thinner. That happens, yeah.
Okay. Doctor, does hair loss affect the texture and color? The same person is asking. Doctor, hair loss affect the texture and color of regrowing hair?
Again, see, जब हम लोग हेयर लॉस के बारे में बात कर रहे हैं तो हमें रीजन भी पता होना चाहिए. और अगर आपका हेयर का टेक्सचर खराब हो रहा है या आपका हेयर का कलर खराब हो रहा है तो देयर इज एन अंडरलाइंग कॉज बिहाइंड इट ना. सो यू हैव टू ट्रीट दैट. हेयर लॉस जिस वजह से रहा है उसी वजह से आपके बाल भी अच्छे नहीं आ रहे हैं तो आपको उसको ट्रीट करना है.
Okay, another very interesting question. Doctor, I stay out of India in UK and there are not much thing I can do to my hair, but I usually go for hair spa. So can hair spa control my hair fall?
Not at all. We discussed that. No hair spa, no keratin, no all these artificial treatments for your hair. Don't believe in all these things because the underlying cause has to be treated. You cannot believe on unscientific things to cure you. Science has to be the base, right?
Mm.
So you cannot just believe that one massage will cure your hair loss. That doesn't happen.
Just to, pamper yourself, you can.
Yeah, you can go for all this for pampering yourself, but please don't use any chemicals in it because that can increase your hair loss further.
Yeah. Another question from our viewer is, ma'am, I'm suffering from alopecia areata. What should I do? Uh, what can I do? Yeah.
Alopecia areata is an autoimmune cause. Okay, so it is related to your immune system. So when your immune system is involved, you need to consult a doctor and you need to have a proper treatment of it. So you have to go for certain investigations and get yourself treated. And sometimes it takes months together. Sometimes it takes years also to get yourself treated. So you have to be in consistent touch with your consultant. That is very important.
So when someone is facing alopecia areata, they need to take medication for whole life, or
Of
it's just.
course, not whole life, because that condition depends. If it is scarring, if it is non-scarring, cicatricial, non-cicatricial, again, yeah, that is further classification. So you have to basically visit your doctor to know what is the grade and what is the kind of alopecia you're facing.
Another question from our viewer is, Doctor, my wife recently diagnosed from trichotillomania, and is it treatable?
Trichotillomania is basically when you pluck your hair unknowingly. So it is a condition related to your uh, psyche. So you need to visit a psychiatrist first. That why is it happening? Of course, trichotillomania is curable, but you need to take help of dermatologist and psychiatrist at the same time.
Okay, so like once the hair is like breakage of hair can be regrow.
Of course, it can.
Okay. Okay.
Because what happens in trichotillomania, people unknowingly pluck their hair.
Okay.
Unknowingly, sometimes halfway, sometimes full. So they don't know it that they are doing it. And they constantly get a habit of doing it. So once that is corrected, of course your hair can come back.
Yeah. We girls keep doing these days. These days.
That is not trichotillomania.
I'm thinking what. Yeah. Whenever we
No.
are in a deep thought, we do this.
So those people are in much deeper thought. So they pull it. Some people have a habit of pulling it and eating it also. That's trichophagia.
Okay. Doctor, another question is, डॉक्टर मैं आपने कहा हेयर कलर कम करना चाहिए तो क्या मैं आयुर्वेदिक मेहंदी कर लूं कलरिंग के लिए?
So when it comes to mehndi, what henna does, henna actually dries up your scalp and it worsens it further. So there are dermatologically tested medical hair colors available. You can use that. But again, some people have allergic to hair colors, so you should not use it.
Okay. Okay. Another question from our viewer is, Doctor, I'm having dry scalp and lot of dandruff. So is it because of infection or should I just go directly to the doctor?
As we discussed in this whole discussion, please visit your dermatologist and get yourself treated because having dandruff is not a normal condition.
Okay. One more interesting question. Are home remedy as effective as professional treatment for hair fall?
Not at all.
Yeah.
Not
Uh,
at all.
and Doctor, I have a lot of split ends. Can split ends be like reverse or can it be corrected?
Of course, we discussed, right? We have to uh, actually improve the texture of our hair, improve the diameter of our hair, keep our scalp clean, go for trimming every 2 months. Yeah, you have to do that. It can be corrected.
The same person is asking, how many weeks should I go for haircuts?
We discussed you should go for every 2 months,
Once.
go for a haircut.
Okay.
And people have a habit of tying their hair very tight. And कुछ लोगों की आदत होती है कि सेम हेयर स्टाइल ईयर्स से कर रहे हैं. You should change the parting also sometimes, because अगर आप सेम parting कर रहे हैं from ears, तो आप मान लो अगर if you're parting from middle, some people have कि यहाँ पे बाल बचते ही नहीं है. कुछ लोग बहुत टाइटली बाल बांधते हैं, तो इस पूरे एरिया से बाल चले जाते हैं. That's called fractional alopecia. So you should be quite gentle with your hair. Keep on changing your hairstyle also. That's fun, right?
Okay. So I'll just quickly take one last question from our viewers because we are running out of time. Doctor, nowadays a detox thing is very going focus like important. So should I take a detox and it will make my hair grow long and it will detox everything from my body?
See, what detox are we talking about? I don't know. But if she's saying that detox diet or something, so first of all, you cannot go for any crash dieting. Because अगर आप crash dieting कर रहे हैं, then certainly micronutrients will not be absorbed in your body, and that can cause further hair loss also. So internal cleansing is important, but you should start eating clean. आप junk avoid कीजिए, आप अपना लाइफस्टाइल ठीक कर लीजिए, आप अपना स्लीप साइकिल इंप्रूव कर लीजिए, आप अपने स्ट्रेस लेवल्स को इंप्रूव कर लीजिए. दैट इज मोर देन एनफ. यू डोंट नीड एनीथिंग फैंसी टू look good or to live in a healthy body, right? Just do basics. Just get your basics right. That's all.
Yeah, instead of doing extra things by yourself, better to visit
Of
the.
course, of course. Just don't get influenced by influencers. That is very much important. Stick to your basics, and if you face any issues, please consult a qualified dermatologist when it comes to your hair, skin, and nails. We are always there to help you.
Yes, doctor. So, doctor, would you like to give a take-home message or any suggestion to our viewers today?
My only take home message is that please don't indulge into self treatment, and don't indulge into something very fancy or chemical treatments. Just treat your hair perfectly, uh, and have a balanced diet, stay stress free, and live your life happily. That's all. And for any issues you're facing with your scalp, with your skin, with your nails, please consult a qualified dermatologist. That would be it. And don't go for Google remedies. Don't do that.
Thank you so much, doctor, for sharing so much of information and all your expertise with us, and for answering all the questions of our viewers today. I'm sure our viewers have found the session very helpful. Thank you, doctor. It was a delight to have you, and thank you for your valuable.
Thank you. Thank you so much, Mona. It was actually interesting. I never expected that people will ask me such beautiful array of questions today. So it was actually very interactive. And thank you, Team IPCA, for making it possible. Amazing. Thank you so much.
Doctor, I don't want to miss this like a question from our live audience because he requests that I want to visit your clinic with my wife for trichotillomania. Can I
Okay.
come to your clinic?
Of course, you're welcome. You can always come.
So I don't want it to miss that.
Thank you so much.
Yeah. Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma, your host, signing off for today. Thank you, doctor.